Picture this for a second. You wake up early in the morning with that strange, heavy pressure sitting deep in your lower belly. At first, you try to ignore it. You walk into the bathroom, sit down, and wait quietly, hoping your body will do what it normally does. But nothing happens. You push a little harder. Still nothing. Maybe it is just stress. Maybe you need another cup of coffee. That is what most people tell themselves. So you get up, try to move around, drink something warm, and come back again later. Same result. But now something feels different. And honestly, this is the moment many people remember later and realize their body was already warning them. The pressure starts turning into pain. Not sharp pain, not sudden pain. A deep, dull ache that spreads from the lower abdomen into the pelvis and lower back. Your stomach feels swollen, bloated, heavy, almost feverish. And somewhere in the back of your mind, a quiet voice begins whispering that something is seriously wrong. If that situation sounds familiar, then pay close attention. Because what looks like ordinary constipation can actually become a dangerous medical emergency, especially in adults over the age of 60. Today we are talking about stool that becomes physically trapped inside the rectum, a fecal impaction. And really, when you strip away the medical language, what we are describing is this: waste that has hardened so much inside the body that it can no longer move. Most people completely misunderstand how this happens. They treat digestive problems like a minor inconvenience, like a dripping faucet you can ignore for a few days until it fixes itself. But the reality is far more serious. This is not a faucet. This is a pipe that has locked shut, and the reason it happens is actually frighteningly simple. Your large intestine, a tube nearly 5 foot long winding through the abdomen, has one major responsibility. It removes water from waste. It is incredibly efficient at doing this. Almost too efficient. Because when stool sits inside the colon too long, the intestine does not realize it should stop pulling moisture out. Hour after hour, day after day, more water is removed. And slowly, something soft becomes dense, thick, dry, hardened almost like clay. But here is what catches most people completely off guard. This rarely happens overnight. It usually develops slowly over 3, 4, sometimes even 7 or 8 days. And during that time, the symptoms can seem surprisingly mild. Maybe you feel slightly uncomfortable. Maybe a little sluggish. Maybe you are still using the bathroom occasionally, which tricks you into believing everything is fine. But the truth is very different. Each trip to the bathroom only removes a small portion. A little comes out. A large amount stays behind. Then the same thing happens the next day, and the next. Think about trying to force a rough stone through a garden hose. It does not slide forward, it wedges itself tighter. The harder you push, the more stuck it becomes. That is exactly what is happening inside the lower digestive tract during a fecal impaction. And this is important because many people believe straining harder will solve the problem. But really, the opposite happens. Excessive pushing compresses the hardened mass even further. Now, here is the part older adults especially need to hear. After the age of 60, the body becomes dramatically more vulnerable to this condition. Several biological changes begin happening at the same time. The muscles of the intestine naturally slow down. Signals from the gut become less reliable, meaning the body no longer communicates urgency as clearly as it once did. Many older adults are taking medications that slow intestinal movement even more. Blood pressure medications, pain medications, antidepressants, iron supplements, calcium supplements, and then there is dehydration. The natural thirst reflex weakens with age, which means many seniors walk around mildly dehydrated every day without even feeling thirsty. So this situation is not a personal failure. And really that matters to understand. This is often the result of multiple biological factors colliding together in the perfect storm nobody properly warned people about. But now we need to talk about the symptoms, because this is where things become dangerous. The signs of a fecal impaction are incredibly misleading, and honestly, they fool people into doing exactly the wrong thing. The first symptom that confuses almost everyone is watery diarrhea. That sounds impossible at first. People think, how could I be constipated if I have diarrhea? But the reality is shocking. When a rock-hard blockage completely seals the rectum, newer liquid waste coming from higher in the colon cannot pass normally. So instead, it leaks around the edges of the blockage as watery discharge. This is called overflow diarrhea. And here is the dangerous part. People assume they have a stomach virus or intestinal infection. So they take antidiarrheal medication. But those medications slow intestinal movement even more. Instead of helping, they allow the blockage to continue hardening and growing larger inside the body. If watery discharge appears together with heavy rectal pressure or that deep aching feeling of fullness, antidiarrheal medication is one of the worst things you can take. The second symptom surprises almost everybody because it involves the bladder. Suddenly, urination becomes difficult. You feel pressure, you feel the urge to go, but only a small painful trickle comes out. Sometimes people feel like they need to urinate every few minutes but barely produce anything. And really, this is not a coincidence at all. The rectum and bladder sit extremely close together inside the pelvis. When the rectum swells with a large, hardened mass, it physically pushes against the bladder and urethra, making normal urination difficult or even impossible. In severe cases, urinary retention itself becomes a medical emergency. Then comes another symptom many people completely overlook. Lower back pain, a deep aching pressure across the lumbar region that does not seem connected to digestion at all. Many assume it is arthritis or muscle strain. But when pressure builds inside the rectum, the pain radiates outward into the lower back, hips, and thighs. And there is one more warning sign older adults cannot afford to ignore. Sudden confusion, disorientation, agitation, changes in mental clarity. It sounds strange, but significant bowel obstruction in seniors can create intense physical stress throughout the body. In some cases, toxic buildup may also contribute to confusion and cognitive changes. So if an elderly loved one suddenly seems mentally off without an obvious explanation, bowel function should absolutely be considered as part of the problem. Now we need to speak honestly about how serious this condition can become, because too many people treat a fecal impaction like a temporary inconvenience instead of the genuine medical emergency it can turn into. And really, the progression follows a very predictable pattern. Stage 1 begins when the intestinal wall stretches beyond what it was designed to handle. The bowel is living muscle tissue. It depends on healthy blood flow and coordinated contractions to move waste forward. But as pressure builds, blood supply to that tissue starts decreasing. The muscle weakens, movement slows. Eventually, part of the bowel can almost shut down completely. Clinicians call this an ileus, where the intestine essentially stops pushing waste forward the way it should. Then comes stage 2. The pressure spreads upward into higher sections of the colon. What began as a blockage low in the rectum starts affecting larger portions of the digestive tract. At this point, people begin looking visibly sick. Nausea appears. Vomiting begins. The abdomen becomes swollen and distended. The person feels exhausted, weak, and deeply uncomfortable. But stage 3 is the moment everything becomes life-threatening. Because the intestinal wall has limits. And when those limits are exceeded, the bowel tears. This is called bowel perforation. When that happens, fecal material, bacteria, and toxic digestive waste spill directly into the abdominal cavity. A severe infection called peritonitis develops rapidly. Without emergency surgery, it becomes fatal. And honestly, this is not being said to frighten anyone unnecessarily. It is being said because ignoring this condition can have catastrophic consequences much faster than people realize. The line between serious and deadly is not as wide as most assume. So what does the danger zone actually look like? These are the symptoms that mean immediate emergency care is necessary. A rigid abdomen that feels hard like a board. A fever above 101 degrees Fahrenheit. Severe worsening abdominal pain that does not come and go but stays constant. Complete inability to pass gas. Persistent vomiting. Or sudden confusion accompanied by low blood pressure, cold skin, and weakness. Those are not symptoms to monitor overnight. Those are go-now symptoms. Now let us shift into the most important part of this conversation. What should someone actually do if this is happening? The first instruction is incredibly important. Stop straining immediately. And really, this cannot be emphasized enough. Pushing harder does not solve a fecal impaction. It increases pressure inside the abdomen, irritates already inflamed tissue, and raises the risk of hemorrhoids or rectal tears. A hardened blockage does not magically move because somebody strains harder on the toilet. So the first step is to stop forcing. The next step involves lubrication and softening using adult glycerin suppositories available over the counter at pharmacies. But here is something many people do not know. For a major hardened blockage in an adult, one suppository is often not enough. The common approach for a significant rectal impaction involves using 2 to 3 suppositories at the same time, because a single one may not provide enough lubrication to soften the entire mass. And the way this is done matters enormously. First, do not stand upright. Lie on the left side. This left lateral position helps align the sigmoid colon and rectum so gravity assists instead of working against the body. Next, apply generous water-based lubricant to each suppository before insertion. This is important because the rectal tissue is already irritated and inflamed. Then gently insert all 3 suppositories as deeply as possible so they sit against the hardened blockage instead of near the opening where they can simply fall out. And now comes the part people usually ruin. You must remain lying still for at least 30 to 45 minutes. Not 5 minutes, not 10. The glycerin needs time to melt, spread, soften the outer layer of the blockage, and stimulate the rectal wall itself to release moisture. If someone immediately rushes to the toilet after a few minutes, the process accomplishes almost nothing. After waiting 30 to 45 minutes, slowly get up and try using the bathroom without straining aggressively. If movement happens, excellent. If not, stay calm. Do not panic. Do not force. The next step is rest, gentle walking, hydration, and repetition. If the first attempt produces no movement, rest for about 1 hour. Walk slowly around the house. Drink a full glass of warm water because warmth can help relax intestinal muscles. Then repeat the suppository process exactly the same way. And honestly, many times the second round is what finally works. The first application softens the outer surface. The second reaches deeper into the hardened center. But there is an important limit here. If 2 full rounds fail completely, or if severe emergency symptoms appear at any point, it is time to seek urgent medical care. That is not failure. That is the correct medical decision. Inside the hospital, doctors have access to stronger clinical-grade enemas using larger fluid volumes delivered under controlled pressure. They also have imaging tools that can evaluate how extensive the blockage has become and whether the bowel wall itself is in danger. And in some severe situations, a procedure called manual disimpaction becomes necessary. Now, honestly, this sounds frightening when people first hear it, but understanding it removes much of the fear. During manual disimpaction, a physician physically breaks apart and removes the hardened stool using gloved, lubricated fingers. If the surrounding tissue is severely inflamed or the blockage is especially serious, this procedure is not performed casually while the patient remains fully awake in pain. Appropriate sedation or anesthesia may be used so the rectal muscles can fully relax and discomfort is minimized. And although it is a serious medical procedure, it is also a well-established and safe intervention. Patients often describe the relief afterward as immediate and overwhelming because the pressure inside the pelvis suddenly disappears. But clearing the blockage alone is not enough, because if the underlying causes are not corrected, the entire cycle repeats itself again, and usually the second episode comes faster than the first, then the third comes even faster. This is how chronic fecal impaction develops into a repeating pattern that gradually worsens over time. So now we have to talk about long-term prevention, especially for adults over 60 where the biological risk factors are already working against them every day. The first and most important factor is hydration. Water is absolutely essential. The large intestine continuously removes moisture from waste. If the body does not receive enough incoming fluid, stool naturally becomes harder and drier as it moves through the colon. And the challenge for seniors is that chronic dehydration often develops silently. A person may not feel thirsty at all and still be significantly dehydrated at the cellular level. The practical recommendation is simple. Do not wait for thirst. Drink 6 to 8 glasses of water spread throughout the day, including 1 full glass first thing in the morning before eating or drinking anything else. That early morning water activates something called the gastrocolic reflex, a natural wave of intestinal movement triggered when fluid enters an empty stomach. And really, it is one of the simplest medication-free ways to encourage regular bowel movements naturally. The next thing people underestimate is movement. Your intestine is not just a passive tube sitting inside the body. It is active muscle tissue constantly creating rhythmic contractions that move waste forward through the digestive tract. This process is called peristalsis. And what is truly important to understand is that body movement directly stimulates intestinal movement. Even a gentle 20 to 30-minute walk after meals has been shown to significantly improve transit time through the intestines. For older adults dealing with limited mobility, chronic pain, or long periods of sitting, even simple chair exercises, light stretching, gentle yoga, or slow torso rotations can help keep the intestinal muscles active. But prolonged sitting, especially after meals, quietly becomes one of the biggest contributors to constipation in seniors. Now let us talk about medications, because this issue affects millions of people without them realizing it. A huge number of commonly prescribed medications slow intestinal motility. Opioid pain relievers, calcium channel blockers used for blood pressure, iron supplements, high-dose calcium supplements, antidepressants, diuretics, antihistamines. All of these can dramatically reduce normal bowel movement activity. And really, this does not mean somebody should suddenly stop taking important medication. It means they need to have a direct conversation with their physician about bowel function. Many doctors simply do not raise the topic unless patients bring it up themselves. So ask clearly, could my medications be contributing to constipation? And are there alternatives with less impact on digestion? That conversation matters far more than people think. Now, there is another issue that causes enormous long-term damage when handled incorrectly: stimulant laxatives. These products force the intestines to contract chemically. In genuine short-term situations, they can absolutely be useful. But when people begin depending on them daily, the intestine gradually adapts to that external stimulation. Over time, the bowel becomes weaker at initiating movement naturally on its own. This condition is called laxative dependency or cathartic colon. And honestly, it is much more common in older adults than most people realize. If someone has been using stimulant laxatives every single day for more than 2 or 3 weeks, they should speak with their doctor before suddenly stopping. The goal is to gradually rebuild natural bowel function through hydration, movement, routine, and proper digestive habits instead of chemical stimulation alone. Now, another prevention strategy sounds almost too simple to matter, but the body responds strongly to routine. The digestive system follows circadian rhythms just like sleep patterns do. The gastrocolic reflex is strongest within 30 minutes of waking up and especially within 30 minutes after breakfast. That is the window the body naturally prefers for bowel movement activity, so use it consistently every day. Go to the bathroom at the same time each morning, whether there is a strong urge or not. Sit down. Relax. Give the body 5 to 10 minutes without rushing. Over 1 to 3 weeks, many people find their digestive system gradually synchronizes with that schedule. Consistency becomes training for the bowel itself. And posture matters far more than most people realize. Human anatomy was never truly designed for modern seated toilet posture where the thighs remain at a 90-degree angle. A slightly squatted position relaxes the puborectalis muscle more effectively. This muscle naturally creates a bend in the rectum that can partially restrict evacuation. But when the knees rise above hip level, that angle straightens significantly. And honestly, something as simple as placing a small footstool beneath the feet while sitting on the toilet can dramatically improve bowel emptying mechanics, especially in older adults with weakened pelvic floor muscles. Now, before closing, there is one group of people who especially need to hear this information: caregivers. Because fecal impaction is extremely common among bedridden elderly adults and people with limited mobility. Very often, the first person to recognize the problem is not the patient, but the caregiver watching the warning signs develop. If an older adult has gone 3 or more days without a meaningful bowel movement, begins complaining of abdominal pressure or lower back pain, appears restless, confused, agitated, or increasingly uncomfortable, do not assume the problem will simply resolve by itself. The risks are higher in frail elderly individuals than in younger, healthy adults. Their intestinal walls are less resilient. Their ability to describe symptoms may be limited, and the complications can progress much more rapidly. Practical steps include encouraging warm fluids throughout the day, assisting with gentle movement or repositioning, and considering a glycerin suppository early around day 2 or 3 instead of waiting until day 6, when the situation has already become severe. And if there is uncertainty, contact a physician immediately. A simple abdominal X-ray can often confirm a fecal impaction within minutes. Most importantly, nobody should feel embarrassed discussing this condition. This is a real medical issue affecting a significant percentage of elderly adults both at home and inside care facilities. Silence only increases the danger, so let us quickly bring everything together clearly. A fecal impaction is not a small inconvenience. It is a serious medical condition where stool becomes physically trapped inside the rectum and gradually hardens over time. The warning signs include persistent rectal heaviness, difficulty passing stool, watery overflow discharge that resembles diarrhea, difficulty urinating, lower back pain, and, in older adults, sudden confusion or agitation. The emergency response is equally important. Stop straining immediately. Use 2 to 3 adult glycerin suppositories with generous lubrication while lying on the left side for at least 30 to 45 minutes. Repeat once if necessary. And if home treatment fails or emergency symptoms appear, seek urgent medical attention immediately. For long-term prevention, focus on hydration above everything else. Drink water consistently throughout the day, move the body daily, review medications with a physician, avoid dependency on stimulant laxatives, establish a regular bathroom schedule, and improve toilet posture using a footstool when necessary. Digestive health affects energy, immunity, mental clarity, and overall quality of life far more deeply than most people understand. But unfortunately, it remains one of the most ignored aspects of senior health because people feel uncomfortable talking about it. Well, now the conversation has happened, and hopefully, after hearing all of this, you feel more informed, more prepared, and more empowered to recognize the warning signs before they become life-threatening. If this information was useful to you, leave a comment below and share your thoughts or experiences. Like and subscribe if you want more direct, honest health education that explains the things most people are too uncomfortable to discuss openly. Take care of yourself and drink your water. Thanks for watching. See you in the next one.